Dear friends, before we will start, I just want to ask you, can we vote for your specialty? How many pediatricians do we have here? One? Do I have here someone who works with pediatric diabetes? Oh, the same person. So we will concentrate more on adult part of this transition then, but of course we will talk a lot about adolescence in this topic. Again, thank you for your comments and your emails about asking the slides, and I will repeat that if you need something from this lecture, any link or guidelines or pictures or all presentation, you can just simply email me for this address and I will send you everything today or tomorrow. So don't be shy, please ask me because I'm here to spread my vision of this topic. It's very thankful for me, it's a pleasure to speak about this because I know that it's very important all over the world to speak about transition from pediatric diabetes care to adult diabetes care, and this problem is the same everywhere. And if we are talking about this, I just want to emphasize that, of course, we need to dream big about it and to work hard on it. Why? Because the situation almost everywhere is the same. We have a huge problem with glycemic control in this age category, but you need to remember that adolescents are the same all over the world and all over the time periods, because even Aristotle said that teenagers these days, his days, are out of control. Do you have the same teenagers here? They eat like pigs, they are disrespectful of adults, they interrupt and contradict their parents, and they terrorize their teachers. And it's also true for everything which they're doing with their diabetes. That's why I want to add here that we don't need to stigmatize this non-compliance for our adolescents, because they are who they are. And if we'll just start to discuss transition, of course we have a definition, and what is this? Is purposeful, planned movement of adolescents and young adults with chronic physical and medical condition from child-centered to adult-oriented healthcare system. Why we should discuss it? Because teenagers' minds are the same everywhere. And if we're just going through all these stages of their development, I just need to remind you something about major developmental issues in children and adolescents of diabetes management. So first, it's about preventing and right treatment. Again, about hyperglycemia. Next stage is preventing and right treatment of hyperglycemia and coping with predictable appetite and activity. And when we are moving to older children age and even to early adolescence, it's about increasing insulin requirements, more difficult control, of course, weight and body concerns, and we'll discuss it later a little bit. And here we just start to remember about transition and integrating diabetes into new lifestyle. And also we have different priorities during their life. And if we are just looking at adolescents and young adults, of course it's something about responsibility on their disease. And just again, we need to remember also about complications, even in this age category, and sometimes we just have early stages of this chronic complication, even in this phase of life. What we need to remember, we also need to remember why the transition process is so difficult, because we have key developmental tasks of adolescents, and first of all, it's about separating from parents. Do you agree with that? Do you hear something from your teenagers about it? That what discuss with you or with doctors, anything? Of course, become an individual able to independently from opinions, ideals, goals, and of course they want to be more independent from everything, especially from everything about their diabetes. And where is the part for us as parents here or medical doctors here? Just this small part of their mind. That's why in diabetes, this conflict is associated with worse adherence, worse metabolic control, worse quality of life, and sometimes even with increased depressive symptoms. That's why ISPAD guideline wrote that psychologists in diabetes team is necessary for all teenagers living with diabetes. When we're just trying to understand what's also going on during our COVID-19 era, of course, for children and adolescents, it's also very difficult, and we need to think again about education and about proper transition here, and use everything we can use for them. As an example, just want to share this book which was published last year about My Hero Is You, about children on COVID-19. You can use it because it's published in all languages, in Arabic too. And of course, you need to use some sort of online education, because during our lockdown, we use for newly diagnosed teenagers and children these online camps with all things and online courses about type 1 diabetes. And we still have barriers to success and barriers to good transition way, because it's about burnout, inadequate motivation and support in this age, weight gain, fear of arterial hypoglycemia, and of course, we need to have more often blood glucose monitoring. And we have, of course, in addition, a lot of things to the adolescents to remember. It's still an issue when you're just thinking about transition and everything which goes through this period of time. It's a mission of insulin to control weight and the high frequency of eating disorders still with high rate of mortality. And again, there are so many things which are going on in their life in this period, with driving, psychology, comorbidities, complications, alcohol, smoking, drugs, nutrition, even diabetic ketoacidosis. And what we can do, we can just have a lot of strategies and all these things which are going through their life. And use education, because it can be specific here. So, what we need to remember when we start to think about transition? There are 5 milestones here. Of course, children here completing school, sometimes leaving home, becoming, even at least trying to become financially independent, getting married, having a child, and on the top manage their own disease. And if you're just trying to imagine what we need to do first, we need, as a healthcare providers and families, should begin to prepare youth in early to adolescence and as late as at least 1 year before the transition to adult health service. And both pediatricians and adult healthcare providers should assist and provide support here. What recommendation do we have here? Of course, it needs to be person-centered and need-focused, include lifestyle, psychological, educational, vocational, medical issues, not just discussing blood glucose level, insulin pumps, and monitoring system. We need to involve young person and family into planning of transition. Of course, with opportunity for young people to make appointments and consultations without parents, because it's very important for them. I hope that you still remember these key developmental issues in the adolescent age. And let young person gain independence and take responsibility for their own healthcare choices. When to start? How we can do it? So first, I just would like to tell that not teach and tell, but collaborate and empower. What strategies do we have here? What works? There are several possible ways. It's familiarity with the adult physician, young adult clinic, transfer to an adult clinic in the same hospital, transition coordinator, and some sort of integrated system navigator. Let's go through all of them just to understand how you can use it in your practice. So of course, first of all, and there's a lot of publication in this field, I just want to show you one example. It's about familiarity with the adult physician, and it's a very interesting publication a few years ago. It's about dividing of possibilities, how you can use the transition, and it was, as you can see here, 4 possibilities. C, D, with meetings with adult endocrinologists before transition. And the results showed this, even also these C and D things was better for our patients. So the familiarity with the adult physician is a working strategy. What about the young adult clinics? Do you have this in Egypt? Like specialized clinic for young adults with diabetes? No? ADA and NICE guidelines supported this idea, but there are a lot of issues here with dropout rates in the order of 20–30% still, and glycemic control is frequently above target again. And sometimes it's very difficult because it's still disengagement rates is very high, and there is still not enough evidence base of benefit as a standard way. So we just need maybe to have more research in this field. There are some publications about successful transfer to an adult clinic in the same hospital, and I think it's very, very helpful because you can see here that patients were agreed to do through this way as a better way. And if you go through this and also can influence on HbA1c level, so as a glycemic control result for us, it's a good possibility to go through transition. What about transition coordinators? It's a very interesting approach because you don't need to have a special doctors or even one doctors or even general practitioner here. You can just use diabetes educator or nurse or even some volunteers who can help you with appointments and calling or texting or just doing something to remind the patients about their appointments to the adult clinic. And there is a lot good results here, even with decreasing number of DKA and length of hospital stay for patients after transition. What about integrated system navigator? You can use everything here with internet resources, mobile applications, social media, and so on and so forth, as we discussed during technology talk today morning. But of course, we need publications here because the most popular publication here was published in 2008, so a lot of years ago. But there is not still a lot of publication here, and it was two groups of patients who use or didn't use this Maestro system, who navigated patients through transition process, and of course with great advantage for those of them who use it. So what issues should be addressed by future in transition research? Of course, we need to understand and have a good assessment of readiness to transition, because in what age, for example, in your countries, children go through this? Because in Russia we have 18 years old. The same? The same? It's 18. So, but sometimes our research is telling us that sometimes it's too early for some children. Maybe we need to change this time for 25 years old or even 28 years old. And so we need, again, evidence-based medicine here, any data here, because it can be very, very useful. And we need to have more studies on models on transition. And of course, we need to have more publications about it. For example, in Russia, last month, we have one great review on this. And I'm just asking you to be active in this field, because with a lot of publication, we can choose, change situation for our patients with diabetes. So what about take-home messages? Of course, transition to adult care requires appropriate planning and discussion of opinions, well advanced in the event of transfer. Disengagement from special services during and after the transition process is common in young adults with type 1 diabetes, and failure to successfully transition is associated with increased risk of dangerous situation, even with decay rate. And the final slide, it's about approaches to overcome barriers in adolescence, because we discussed the differences from all other age categories. Right diagnosis is important, family support and psychological issues matter, flexibility in dietary and management plan, very important, extended outreach and support, providing realistic expectation and achievable goals for our adolescents, and of course, our help in transition period. And just a simple sentence, adolescence is a difficult period of time, but we need to remember about key development tasks of this period. Thank you for your attention. And again, if you need something, just email me.
Thank you, Professor Evgenia, for this lecture about the transition from the pediatrics to the adult care. Do you have any questions from the floor? Thank you so much. Have a good night. كده بنقفل السيشن وندعو السادة رؤساء الجلسة اللي بعدها يتفضلوا إن شاء الله. شكرا.